Jonathan Lee Riches investigates, reporting from Yuma, Arizona. I am out front of the Yuma Regional Medical Center. Why am I here? Well, I am covering the border migrant crisis. And there is a crisis going on at this hospital here. This is the only hospital in the Yuma area, and they are facing a dire crisis when it comes to the migrant situation. Migrants that are crossing into the country illegally, or people, migrants, people, whatever you want to call them, are crossing over illegally in this area in record numbers. A lot of them have health issues, and a lot of them end up at this hospital here. Women, pregnant women, men that have pre-existing health conditions that they had wherever they came from, malnutrition on individuals. This is causing a financial strain, epic proportions on this hospital here. Let me turn this camera around, show you this hospital, and then we're going to talk more about what is going on at Yuma Regional Medical Center. So this is the hospital here, folks, and they are facing a major crisis at this hospital. Let me read you a report from Fox News. Border towns, only hospital running out of resources, on the brink of collapse, caring for migrants. Yuma Regional Medical Center chief says residents suffer as a result of delayed care. The migrant surge is overwhelming a border town's only hospital, which is the hospital you see right here, folks. The facilities director told Fox News. Yuma Regional Medical Center, the only hospital within 60 miles, has been forced to delay residents' care to treat scores of illegal immigrants, many of them pregnant women. Meanwhile, the hospital is racking up millions in unpaid expenses. Over the past 6 months, caring for migrants has cost the 406-bed facility at least $20 million, with no one to foot the bill, according to the center's president and CEO, Dr. Robert Trenskill. Let's read on. That's an unsustainable model to have that unexpected expense without any revenue to offset it, Trenskill said. It's a no-win situation. We are running out of resources. We had to hire additional staff. In total, around 6 million migrants, including 1.2 million gotaways, have crossed the southern border since Biden took office, according to Customs and Border Protection. It's unfair to residents of our community, too, because we're providing free medical care to these individuals. The residents of our community don't get free care. They don't get free care. Probably most of them that come to this hospital probably go into emergency care right there. Pregnant women, lots of pregnant women. He also told Fox News his facility's maternity unit has reached capacity since the largest number of migrant patients requiring care are pregnant. The next closest hospital is 62 miles away. Recently stopped providing labor and delivery services. We would have to delay some of the planned inductions for our residents because of that. Our residents had to suffer long enough. Hospital staff has faced additional burdens working around language barriers and providing medical equipment to ensure safe discharges. These individuals take at least 3 times the number of human resources to resolve their cases and get them a safe discharge as a regular patient in our hospital. The hospital is also packed with flu and COVID-19 patients. This is a crisis, folks, at this hospital. And this is not the only hospital that we've been hearing nationwide facing the same similar type of crisis. New York City hospitals, Denver, they are running out of money because, and then also putting Americans on the back burner because these migrants flood the hospital, pregnant women and people sick or with diseases or whatever they have when they came over. They don't have insurance. And they get, for some reason or some laws in most states, allow people without insurance to still get care. So the migrants are racking up millions and millions of dollars, and people, Americans, aren't able to even get in the hospitals as much as they were able to in the past. It is a crisis, and it does affect the medical industry. What's your thoughts on the matter? I've been hearing more about this. Are you a nurse or a doctor or anyone in the medical field that know more about this situation or similar situation that you would like to talk about? Reach out to me, JLR at JLR Investigates. In Yuma, it's a dire situation. We've been hearing, not only with the medical, but we've been hearing that migrants have nowhere to stay. They've been using shelters in most of the cities that they go to, sanctuary cities that they go to. Not only that, folks, but they tap into the social services of the cities, and they're running out of money. And what does that do? Two things. Either raise taxes on the taxpayers to pay for migrants to get free social services, or you cut other services to pay for these migrants using their social services. For instance, cut the police budget like they're doing in New York. Is one day are we going to get a hospital to shut down? Are they going to shut down one day because they just don't have the money? Does the state, what's the state going to do? The state going to intervene here and provide them, but who ultimately will have to pay for that? Probably, most likely, taxpayers. So it's a dire situation. We're bringing attention to it on JLR Investigates, covering the border crisis. Subscribe to my channel, hit the notification button. I'm out front of Yuma's only hospital, 60 miles. There's no other hospital around for 60 miles. We will talk soon. Check out my playlist at the border. Stay tuned.